Dear friends, I am Dr. Ricardo Maldonado, infectious disease specialist at East Alabama Medical Center. An unprecedented crisis made landfall last week in our community. The situation will likely worsen in the next few days. We must know and understand our enemy to defeat it. If we don't, we will not win. If we ignore the enemy, we become the enemy. We have no time. We need to change the way we have lived our lives. We have to reset and learn the new way. In Wuhan, China, the cases of COVID-19 that need to be on a ventilator in an ICU surpassed the number of ICU beds in the whole United States. Even though the mortality was low among the young and healthy, it was quite high among the elderly, up to 15%. We have a less healthy population in the United States. An outbreak in a nursing home in Seattle killed almost 30 people, and in less than 2 weeks, 21 of them required to be on a ventilator, and 70% died. People with COVID-19 infection can transmit the infection by sneezing, coughing, or breathing if you're close enough. Those droplets, if you're close enough, can land on your face and you can become infected. These droplets can also land and survive in certain surfaces for some time. If you touch anything with droplets and then you touch your eyes or your face, you could become infected. That is why washing your hands and performing hand hygiene before touching your face is life-saving. The same rule can be applied to your cell phones and any commonly touched surface at home. Another aspect that is important to discuss is about testing. COVID-19 is already here in our community, and we have to assume that if we have new symptoms of a respiratory infection, it could be COVID-19. 80% of people will have a mild illness, perhaps even milder than the flu, but 20% will get sicker, and they are the ones that will need medical attention. We don't have enough tests for everybody. We have to give those diagnostic tests for those who get really sick, so we know what to do. Here at East Alabama Medical Center, we're working long hours to keep our community protected. Please help us. We need all of you. Help us flattening the curve by practicing social distancing and staying home. Thank you.